who's next? Yeah, recognize Ms. Miller-Meeks, 5 minutes.
Thank you, Mr. Chair. I'd like to speak in support of H.R. 3887, Children's Hospital GME Support Reauthorization Act, introduced by my friend and colleague, Congressman Crenshaw. I know firsthand that a physician's training is a lengthy and expensive process, which is why renewing CHGME to ensure that there is sufficient supply of pediatricians to meet the demand is so important. In fact, I have long supported increasing the number of GME slots and funding. The timely reauthorization of this program through 2028 will continue a legacy of over 20 years of supporting our healthcare providers. However, I am also supportive of the prohibition on GME funding for hospitals that furnish puberty blockers, hormone therapies, and/or surgeries for the purpose of sex alteration care to minors. And let me just say that if anyone in this room thinks that the government is not already involved in the patient-doctor relationship, let me just remind people that during the COVID-19 pandemic, the government, the Biden administration, forced vaccine mandates on everyone, despite calls of physicians such as myself and former directors of public health, that be left to the doctor and patient to determine. And that is not the only example. That's just a very recent example. When this bill was introduced in our recent legislative hearing, the minority witness could only claim that standards of care as scientific justification for the safety of these surgeries and treatment. She could not cite any gold standard randomized controlled trials that showed and evidenced what she was saying or what the ranking member said, nor supportive systematic reviews. The purpose of healthcare is to treat and heal, and it is not in the interest of the American taxpayers to fund these experimental procedures at the expense of the physical and mental well-being of patients. Procedures and drugs that cause permanent and irreversible alterations. To quote our colleague from New Jersey, the ranking member, when talking just recently about providers of Medicaid services for foster children, he just stated, "It should be a high bar." Why should the bar be any lower when we are talking about care that can permanently damage and irreversible to minors? And as a physician and a director of public health, I have had advocacy groups numerous times come to talk to me about young people under age 25 not having the frontal lobe development to make accurate judgments, but yet we think that minors should be able to make decisions for permanent, irreversible, damaging physical alterations. There is a lack of scientific evidence regarding the effectiveness of these medical interventions, especially among minors. Again, we are only talking about minors, which is why countries in Europe, such as Denmark, Britain, and Sweden, have described the treatments. These countries have decided the treatments as experimental, and they have urged doctors to proceed with caution. I rise in support of this bill, and I would urge my colleagues to do the same. I yield back.
Will the gentlelady yield for a second? To the chair?
Yes, I'll yield.
I don't want to take 5 minutes, but I just want to say, look, I said this before, gender dysphoria obviously is real. However, we do have a role in protecting children. We protect children in all kinds of areas, from the local government, state government, and the federal government. And we don't have definitive data. We don't have definitive data on permanently changing people's anatomy when they're children. We just don't have, there just isn't that data. I've talked to children's hospital folks. Europe recognizes that. And we also don't have any data on permanently changing people using puberty blockers. So again, we're talking about children here. Does anyone think that we should take a 12 or 13-year-old anatomically male child and remove their sex organs permanently because they believe that they should, because that's where they are? I would have a hard time arguing that anyone thinks that that's right. Now, if you're 18 years old and you're an adult and you choose to make that decision, well, that's different. But we do have a role in protecting children, and from a scientific standpoint, as a medical doctor, I can't get past that. Do I think that there are people need aggressive treatment for gender dysphoria? You bet. But we're talking here about permanently changing people's anatomy and physiology. And the physiology side, much of it is not reversible. In youth, under the age of 18, you know, and I just, I can't reconcile that. So I will yield back to the gentlelady.
Thank you, and just to quote what was already said, after all, these are children. The children deserve this. The children deserve that we have a high bar, and in all other parts of medicine, when we ask for randomized controlled studies, when we ask for systematic reviews, the bar should be no less for our children. I yield back.
Gentlelady yields back. Now recognize Dr. Ruiz for 5 minutes.
You know,
For what purpose does gentleman?
move to strike the last.
Gentleman's recognized, 5 minutes.
Look, transgender individuals face one of the highest rates